Billy, you mentioned speech pathologist and some of these other professionals, but I guess I'm curious, what are some of the options for voice therapy?
So it winds up being that, so like a speech pathologist that specializes in is probably going to largely be identities. For you might be able to do some remote stuff. One of the other things that I'm seeing a lot of is also singing teachers, singing coaches, things like that. A lot of the techniques that are used by speech pathologists are also used by singing teachers as well, to kind of work through. The good thing is those can be really helpful because if you don't have any pathology as far as any kind of like vocal problem, like maybe you have a paralyzed vocal fold or some other kind of situation where you would require a specialist, but you have perfectly everything's working perfectly fine as far as your vocal cords are, then a singing coach can also be really helpful as far as getting that practical skill of being able to reach those higher notes. And singing is very similar to reaching those that higher frequency and the higher pitch for speaking.
Mm-hmm. Can you tell us a little bit about vocal surgery and what some of these other treatment plans might look like?
Yeah, so surgery is interesting. So you went ahead, and the current one that's, if we're talking about like raising the pitch, it's Wendler glottoplasty. So, and what they do is, the good thing, they don't have to do an incision, but they go through your nose to get down into your vocal cords. And what they do is they first use a laser, and it's the about the front third of that is cut, and then they they'll add in a couple of stitches to be able to seal that actually connect, so then thereby shortening. Just to keep in mind that the length of the vocal cords are very, very small, even in men. People that have vocal folds are probably about 3/4 of an inch to a full inch. And for anybody that doesn't use the stupid imperial thing, the centimeters would be 1.75 centimeters to 2.5 centimeters for typical cis male or trans women. And then for cis women or trans men before testosterone, it works out to be about 1.25 centimeters to 1.75 centimeters, so about half an inch to 3/4 of an inch in size. So it's very, very delicate, and it's a specialty. So that would be one of the big ones as far as vocal. The thing that winds up being the difficult part is you have to do vocal rest for 15 days. That means no talking at all. So you will be using a whiteboard to be able to communicate. But the old method, when they used the knife to make the cut instead of a laser, the recovery time was 30 days without speaking. Jeez. So it definitely takes a lot of time.
Yeah, I mean, it sounds like we're talking about. No, it sounds like we're talking about incredibly invasive and precise kind of work. I mean, operating on something that is 2 centimeters long. Are there risks to the surgery or any of these other treatments that we've been talking about?
Well, let's see here. The good thing is risks are pretty low. What can happen is if the folds don't seal off right, you could have kind of a little bit of a gap, so it'll kind of give you a breathy sound in your voice, or can kind of other ones where it doesn't completely heal, so it kind of makes kind of this kind of rough sound, where there'll be kind of like, you'll have essentially 2 pitches going, where you'll have like your pitch, but then also kind of a lower pitch happening at the same time if it isn't completely sealed properly. So then they would have to come back in and stitch that little part up again. But that, I mean, it's pretty minor as far as like this. There's you'll still have a voice. You may not like the result of that, of how the pitch raising goes, but that it's you're going to have a you will be working with a speech pathologist for a while to go on ahead and kind of make sure that those vocal folds are the part that was stitched together are closely, and that they're symmetrical, because if they're not symmetrical, then they may also have to do some surgery as well. So there's some minor issues that can come up. And then also the risk factors, there's certain, once you get up to a certain age, they don't want to do surgery. So typically, once you hit around 60, they're not going to want to do that kind of surgery anyway.
Yeah, so it all sounds like kind of a lot. Stepping away from vocal surgery, are there any risks to just kind of DIYing these things? Picking up YouTube videos or whatever else to try and explore your own voice or your own range?
Yeah, I think the risks are there. They're relatively minimal. I think the important thing is, if your voice hurts doing the exercises, then either you may not be doing the exercises right, or they may not be good exercises to do in the first place. So you'd want to stop just so you don't damage it further, and just kind of allow yourself to recover. I think that's really the key thing. If it hurts, then not good. You need to stop if it's hurting.
Mm-hmm. Yeah, okay. That feels like useful advice to hold on to.
I'm curious about... Sorry, I'm going to jump in here real quick.
Please.
I know there are quite a few message boards, especially on places like Reddit, where they have I actually follow, I believe it's called r/trans voice or something. And it's very much about individuals rating each other's voices and giving feedback and ideas for, how you could, get it to the pitch you want, to the cadence you want. I'm curious what your thoughts are about, participating in that kind of a community effort.
I think if it can be done constructively, when you said Reddit, I was thinking, are they going to say like, oh, that your voice sounds terrible, and like be really judgmental? So that's what immediately came to my mind, but I'm hoping that if it's supportive, then I could see it as a benefit. I think that's going to be the big thing, because I think we tend to focus on pitch a lot, but there are a lot of different things that do to affect, like your rhythm, your intonation, your pitch variation, your melody, and your voice. There's a lot of different things that wind up happening as well, and also just of the brightness of the vowels you're producing. So typically, like I said, this is based on Western European standards of voice and everything else. So typically the pitch for women tends to go up and down a lot more. The volume stays about the same, and the syllables get a little bit elongated. And like males, typically it's more of the changes in the volume and not really the pitch. And so it's one of those things that kind of goes into those factors of kind of learning how to speak differently. Vowel production for women tends to be a bit more, the vowels tend to be more fronted. So basically, so you have different vowels. So there's back, so like towards your throat, and then fronted vowels like towards your mouth. And so typically women tend to have it fronted, so then it will get you that brighter sound. So like I said, there's these little subtle things, and then that's where it's really good to have somebody to be able to listen to you and kind of go like, okay, does that sound right or not? And I know it's also not a bad idea if you don't have somebody to work with to have some way of recording, so you can kind of see like where you are, and like, okay, well, what does that sound like, and kind of getting used to hearing the voice. It can be very triggering for a lot of people, so I know that's not exactly the most exciting thing to think about, is recording your voice when you're in the process of getting it to where you want it to go. So I'll disclose, as for like me, I had a really deep voice, so like it was really, really, really deep. So that took a lot of work, and it was a lot of effort and time to be able to do that.
Yeah, I hear that. V, I don't know about you, but just doing this show and having my voice recorded so often, the thought of trans folks watching this, wanting to like work on and change their voice and recording it and listening to it back, I guess I just want to say to everybody listening, your voice is beautiful. Your voice is okay. We're excited and proud for you. If you want to make some changes to the way you present, we're totally here cheering you on. But please, please, please don't stress it.
Yeah.
This is a journey. There's not a place to end up
Also,
to.
everybody hates their voice when they hear it back too. Like it took me 3 months of being on the air to watch something back and not just like be cringing the whole time because it was terrible. So we get you.
Yeah.
Well, I know that you asked us
absolutely
each to have a straw handy, and I'm a little bit curious as to why. But before we get into that exercise, I'd like to take one more phone call.